All right, so now I'd like to get us to our speaker, which is the main reason most of you are here. So instead of giving you a lengthy introduction on her bio, which is fabulous, and I know we have them here and many of you have read it, and I think she'll talk a little bit about her background, I just want to tell you how we got her here. We had another speaker lined up, as many of you know, but I was headed to the annual conference for JDRF and had the privilege of hearing Darlene speak at some of the breakout sessions, and then at one of the networking luncheons, she chose to sit at my table. So it was fabulous because she is the Senior Vice President of Research for JDRF, so she oversees the entire research department. So we got to talking, and I invited her to Cleveland and said, we can make a switch and get you here. Not that our other speaker would have been not good, but this was a fabulous opportunity for us. So she rearranged her schedule and made that work so she could come and be here with us this evening. And so I think you'll be very pleased with her remarks and certainly want to open it up for questions too so that we can have that time together. So I want to introduce Darlene Deecher.
Good evening, everyone, and I am really excited to be here, and I'm really glad we could work out schedules so I could come and share your event tonight, so I'm very thankful. We just came through annual conference where we really brought the research team. It's a very different team now. We brought the research team to annual conference, and over again, we kept saying, we are excited. And we are really excited. And I think we're excited because Jeffrey Brewer drives the energy and the vision of what we have to do to actually transform the research department and really start making a run at the cure. And along the way, we're going to do treat and prevent as well. So tonight, I really want to go through what are the changes in the research department, what's going on, what's been happening that's causing this transformation. And yesterday I was on the phone to the International Board Chair, Frank Gracias, and he said to me, he is also going out to an event next week, and I was preparing slides for him, and he said, Darlene, we have to show the renaissance. I've been in this organization for a long time, but I feel it. There's a change coming, and it's transformational. And so tonight what I wanted to share with you is what is going on in the research department, why is there this excitement, why do we believe it's transformational, and what are we doing in the research department as far as moving the research in an area where we're going to be doing things differently and we're absolutely going to be accelerating to the cure. So just to tell you, I'm new to JDRF. I joined JDRF back in September 2009. And I didn't join, obviously, in this position. I was recruited into JDRF to accelerate the artificial pancreas project. Probably a lot of you are very familiar with that project. It's a project that Jeffrey Brewer put a stake in the ground and said, we can do this, we can achieve an artificial pancreas. I want it for my son, and I really want to accelerate this product out so people living with type 1 diabetes can live a better life. So I came aboard back then to be the director of that program, to be on the ground working with the regulators, looking at the research, trying to figure out how to accelerate that program. And then, of course, Jeffrey took over as CEO last summer. I think he took over July 1st or June. And he asked me if I would be willing to take on the role of the senior vice president to come in and look at the research department, to kind of think of it with the same lens that I looked at the artificial pancreas project. I come from a very long career in pharmaceutics where I was in charge of running women's health research discovery and developing therapies in the women's health arena. So I've trained in the hormone therapy area. I'm considered an applied research scientist, so it is about getting new therapies, getting new discoveries in the research end. So I was willing to take that role over under Jeffrey. It's been a firestorm 8 months. I can tell you it's lots of things shaking, and I have to say at the last board meeting, Frank stood up and said, you know, Jeffrey, it's okay that the bolts are coming off the wings of the plane, but just keep the plane in the air, okay? Because he is literally looking at everything and determining what needs to change, what do we have to do different. So it's an exciting time, and I'll share with you some of the new things we're going to be doing. I've looked at all the aspects of our operation, and I hope that we're making good changes to accelerate our mission. So with that, I'll get started. I was telling Laura today when she picked me up, I said, you know, I started with 80 slides. And the reason being is there's so much going on and there's so much excitement, I wanted to share it all. But then I thought, oh my goodness, they're never going to want to sit through 80 slides. So I got down to 60, and I still thought that was too much. So now I'm down to like 30, and all of them, some of them are quick. But there's just a lot going on, and I want you to know that, and so I want to share as much of that as I can with you tonight without boring you to tears about the nuances of what's going on in the department. So at annual conference, Jeffrey stood up and gave an incredibly motivating foundation speech. It was his first one, and I think in that speech, probably the most moving part for me was when he said it's all about lifting the burden, because he truly believes that. It is a burden to live with type 1 diabetes. And so his mission and his goal for the research department is to expand what we do, because it is about the cure and we're driving to the cure, but in the meantime, we've got to have better treatments for those that are living with it, as well as preventing it from ever happening in the first place. And so now you're going to hear us speak, and all the slides and what we're going to be doing this year, you're going to hear us talking about the cure. What are we doing in research towards a cure? What are we doing for better treatments? And I'm going to talk about a few of those areas of treatment that I think we can make a move on, and we're certainly going to fund in those areas to try to accelerate. And we've just launched our prevention program, so I just started a month ago. I brought in a new scientist, and we'll be looking at prevention and ways and how we're going to fund research to try to prevent this disease from ever occurring. So that's new for us. We've got lots of ideas. We're going to set the strategy for prevention, but it's certainly a new area that we'll be investing in. We've expanded. It's every age and it's every stage. Therapies have to reach patients, and Jeffrey will absolutely hold me accountable. That's what he wants, and that's what we're going to do, and that's how we're going to measure our success in the research department. And of course, we have to have gratitude and appreciation for what we've done in the past and what we're going to do. So I talked a little bit about this. The theme of annual conference a month ago was really about transforming the lives of people that have type 1 diabetes as well as their families, transforming the way we do research, which is my responsibility now, and also transforming all aspects of our organizational capabilities, because it is very important that we're as efficient as we can be, and as much as possible the money goes to funding research. So thinking about tonight, I thought that there was 3 areas that you'd probably like to hear about. First of all, I want to tell you about what we're doing in FY12 in the research front. So I'm going to do the first third of the talk about what is the FY12 research strategy lining up, what's it look like. And as I was looking at this slide tonight, I have up here, it's transformative, we're expanding the research portfolio, but I realized that's not quite the right word. We're not exactly expanding it. We're actually becoming more strategic and more focused in what we're doing. And I think that's really important, to be focused and strategic, because you'll accelerate faster. So I think expanding the research portfolio wasn't quite the right choice of words, and I actually made this slide for annual conference, so I'm surprised I put that in there, but I'll talk about that when you see what we're going to do for FY12. And then you're going to hear us talk a lot. The language out of our mouth, our scientists in the field are going to be talking about translation. And I thought I'd spend just a few slides tonight telling you, what does that mean when we talk about translational research? I am a translational scientist working in the pharmaceutical business for a long time. It is about taking science and translating it, applying that science, translating it, and getting a new therapy out the other end, whether it be a new drug or whether it be a new device. And so I'm going to talk to you a little bit just to get you used to hearing the types of language you're going to hear out of the research department about translating. What does it mean?